We shall warm up until when our tongues are hot. Then we shall, when I say, Asante sana, then we clap. Clap like this. If I ask you, if I command that you add until I stop. So we can stand up.
We all stand up.
So that you stretch your waist at the same time. And then put your hands together. Let us start rubbing. I know even my papa will be very happy to hear that this was said in Eldoret. Okay, warm up. Asante sana. Nyongeza tena.
That was a unique one. Thank you. Thank you, Sarah, for that. Let us move to the next session. And our moderator of this session is none other than Faith Kanini from Embu. Sorry, Kitui. My bad, Kitui. Faith, you'll take us through
So thank you very much for this opportunity. I'm from Kitui County, not Embu County, but Embu is our neighbors, and even before revolution, that is where we used to report in our provincial headquarters. So we are going to the last session, which is about wrapping up or summarizing all what we've learned from the panelists. And I request, I forgot her name, Lois, yeah, to take us through the summary, and maybe I'll also handle some of the issues on what we have learned. So, Lois, it's your time.
Good afternoon. So I'll just do a recap of what we have gone through today. So we've had several panels, 4 panels, and very informative. We went through the objectives that we're supposed to do today. And the key things was on facial cleanliness and environmental improvement, integrating it with WASH. And we had the WASH partners, and we discussed on how when we can integrate these facial cleanliness and environmental improvement factors for sustainable elimination in our counties. We also went through cross-border collaboration for sustained elimination. We looked at also how we can come up with ways we can pool resources together to eliminate the disease across the border. We also looked at leveraging One Health this afternoon on integrated trachoma interventions, and we had a very good presentation from Trachoma on how they have integrated their One Health, and it's a very good model that we can replicate in our counties. And we also have gone through now the last panel discussion was on innovative and sustainable approaches for support elimination, including surveillance, and how we can continue doing surveillance so that by the time we have said we have eliminated, we do not have recrudescence happening, so that we completely eliminate the disease. So thank you very much for your engagement throughout the sessions.
Thank you. I made some points on the key points or the best practices that we have learned from all the panelists. This will be a summary, and it is in point form. So I think some of the lessons or the best practices that we have learned is about integration of trachoma elimination to intervention activities to the county health systems, and also mapping of existing partners and intersectoral collaboration. We also need to do surveillance, which is a continuous follow-up of cases and use of data for informed decision making. And the team that has just left have come also up, have also come up with early warning systems. The use of existing structures such as community health promoters and school health clubs to disseminate health messages. Then optimization of available resources, and also we are talking about all the continuous stakeholders engagement and the joint work plan so that we can maximize the available resources. The mainstreaming of trachoma elimination transition plans to the county plans, including CIDP, and work plans and the strategic frameworks. Then county ownership. I think now as we transition, every county at this point, we need to have already started preparing ourselves on owning the plans so that it becomes a county-led work plans or transition plans. The coordination of partners that came out especially during the second panel where we had WASH partners, coordination of these partners and having clear roles and responsibilities for each partner, and then planning appropriately for nomadic population. Then embracing One Health approach, maybe to come again because this appointed captured earlier, and then training of CHPs who are mobile to offer services to the nomadic populations. So there was an issue about social media, change communication to demystify myths and misconceptions, and the message should be a continuous thing. And for effective elimination of trachoma, the face should always, and look at the always, it's in capital letters, from what we got the protest by the professor, it's about the clean face, that's why it's in capital letters.
Channel for passing information need to be friendly to the audience. Then data sharing among the two countries for enhancement of enhanced surveillance. For continuity of service delivery to the nomadic population, outreaches and mobile clinics are appropriate mode of service delivery. Mapping out of nomadic populations and get conversant with their migration routes and their migration periods. There's also GIS mapping of the hotspots, the policy and legal frameworks for the cross-border interventions in the East African community. Also strengthening of strengthened collaboration between Kenya and Uganda, use of written and unwritten cultural or traditional frameworks, resource mobilization through regional blocks, embracing technology for surveillance, leveraging on One Health approach, that one I just said, then community involvement in health activities, ride on SHA as an economic enabler to health care, then capacity building, and I don't know what Uganda will be doing with for Kenya, we want to ride on this SHA, but for Uganda maybe you have your own mode. Then the capacity building and the proper deployment of health care workers, so that after we have trained, at least we have human resource who will be able to address all these issues. I think that is a summary of what came up, and I say thank you, wash and wait. Not wait and wash. Thank you so much.
I have a feeling that we have not appreciated Lois and Faith very well. Okay? Watu wangu wa Kitui. Okay. You don't want to appreciate one of your own? Aya, your neighbors, Embu. Yeah, good. Yeah. We need neighbors like Embu. Huh? Yeah, sure.
Yeah, we know Kamba, because we all originated from the same, I understand, from the same, not Uganda, but somewhere else. So tusimame. So we want to appreciate them through the MBA and the HIV way. So for HIV, we always insist on abstinence. So how do you abstain? So tunawapatia 3 za ku-abstain. 3 abstinence clubs. So 1, 2, 3. No, we are abstaining. Yes. So it's like this. 1, 2, 3. 1 to go. 1, 2, 3. Good. Thank you.
Thank you, Embu. That was a nice one, eh? We are so used to clapping, even when we are told to abstain, we have to clap, yeah, honestly. I want us to, in the next few minutes, we are doing well in terms of time. I hope that we should be done by 4. Now I'd like to invite Titus and Professor, I'm not seeing Professor around, to take us through the validation of the transition plans and possibly share the abridged copies with the respective counties for adoption. Titus.
Okay. I think for this, I'll need the 5 counties, maybe a representative from each of the 5 counties to come. Then together with Prof, we'll just hand over the abridged work.
The counties, Prof, could you come? The counties, each representative from each county, West Pokot, Kitui, Embu, Turkana, and Baringo. Could we all come forward to the podium? Just take the podium, please.
Hand over the abridged versions.
Media. These are abridged versions of the transition plans.
As we were talking about transition plans, we have the big document, but we also have a political document, something that CEC can just read through very fast and get what is required. We don't want to bother them with governance. Whole 80-page document with a lot of details of performance. So this is a brief transition plan for A, M, and E, and
TT as well.
And TT for West Pokot. So yes, so you can. Yes, one is for psychiatrists, and hand that to the West Pokot representative. Congratulations.
Gilbert, I also want you to go to the podium. Yeah, please do. Yeah. Kau simba cha. Kau simba kacha. Kel klami.
Now we have
Thank you. Congratulations to the counties. What we have shared with you are the abridged versions of the work that we have put in place since 2022, right? Since 2022 to date. The bigger volumes, are they bigger volumes, Titus? The bigger versions, the larger versions are still with the printers. As soon as they come out, we'll share them with the respective counties. But the transitions outlines the county's commitments towards continuing with the gains that we have so far acquired in the elimination efforts in the respective counties. So it's a commitment. And one of the key things that came out in yesterday's panel discussions, and I think it was an emphasis by the governor for Baringo, if I can remember well, that we need to integrate trachoma interventions in the annual work plans and county integrated plans. That came out very strongly. So this is part of that process in ensuring that we have that integration, and of course that will be followed by resource allocation for elimination efforts going forward. Otherwise, let me invite Titus for the next steps.
As we are moving along to the tail end of the workshop, these are some of the next steps that have compiled in terms of the national team. We will share. We've compiled the report and we will share to all the meeting participants to make sure that everything that was discussed here has been captured. There will be a national dissemination of these plans. Probably we'll have discussions with partners, or maybe this was a dissemination. We will disseminate and launch the plans. We will be monitoring the implementation of the plans, and we will develop a national level Kenya Trachoma Elimination Program, a store, a repository where we will store all documents, historical and past concerning trachoma. We will establish a national trachoma elimination committee, and which will be tasked to develop the country elimination dossier. In terms of the counties, they will facilitate the signing of the plans. The plans, I know they have been signed previously and validated again. And others have sent the signatures that are on the printers, so that will be done. Participate in the launch and the dissemination of these plans. They will establish county Kenya Trachoma Elimination Program repositories. They'll have them at their counties concerning all the records pertaining to trachoma in their counties. They are the implementers of the plans that we've handed over to them. They will implement what is in there and get support from various partners or bring in support from internally. They will produce monthly, quarterly reports, form of how the implementation of these plans are going on, how many surgeries have been undertaken post-transition, availability of antibiotics to treat trachoma, so on and so forth. And celebrate county level elimination, of which I'm sure all of you are just about to, or just others should even be celebrating the county level elimination. You should not wait for the whole country to eliminate trachoma for us to celebrate. Coordinating partner, they will support finalization of the county level plans, continue supporting establishment of these storage. Once, sometimes ink gets finished at government levels, print for us these documents. You buy for us these files. Support other national level activities that need to be supported for us to be eliminated, to be free of trachoma, like repeat full geographical coverage where it wasn't done well, repeat surveys, focused MDAs, cross-border collaborations, continue supporting cross-border collaborations, surveillance, and the new kid on the block, that is One Health. Support One Health to enhance post-elimination surveillance. Implementing partners, support printing and finalization of these plans, support dissemination, and support implementation where necessary at these final phases of trachoma, and support the monitoring of these transition plans, both at the county and the national level. So that is some of the things that I think will be going on after here. So at this juncture, take it back to the chair for the next.
Thank you, Titus, for that. And that brings us to almost the tail end. And on that note, allow me to invite the following in this order to give closing remarks as we wind up this meeting. I will invite one representative from the counties to represent the counties to give a closing remark. One WASH partner, One Health representative, Ministry of Water representative, Ministry of Education representative, and then I'll also invite the CEC Health, Turkana, to also give a closing remark on behalf of the political leadership of our counties. And then I will invite Gilbert to give a closing remark on behalf of Fred Hollows Foundation. Then I'll invite the tag chair, Professor, to also. And then finally, we'll have the very last closing remark from Kenya National Public Health Institute, locally. Amanda. Okay. Thank you, Lokele, for that. So, one individual from one of the counties to represent the counties. One representative. Jim Ross. Yeah.
Good evening, all. Once again, my name is Tioko Jandros. I'm the County Chief Officer for Preventive and Promotive Health Services. I'd like to take this opportunity to thank the conveners of this session. I know it has been an interactive session, and also my appreciation goes to the country's representative, both from Uganda and Kenya. Really, it has been a consultative meeting, which we need to embrace in order for eliminating this trachoma in our countries. And I'd like also to appreciate the most appreciated model that everyone was appreciating, and we have been all eyeing for this model to be replicated in most of our places or counties. That is the Kinormor model from Turkana County. And we are proud as a county, at least for this model to be integrated in our county, so that we can eliminate trachoma in our counties. And together, when we put all our efforts together, the government and also other international bodies and also the partners, really we will eliminate trachoma from our communities. And for those few remarks, I'd like again to appreciate you all, and together we can eliminate trachoma in our people. Thank you.
Thank you, Madam Jen. Jen Ross, WASH partner, Kwamboka.
Good evening once again. Is it afternoon? Evening. Yeah, my name is Metrin Kwamboka from the African Institute for Health and Development. And on behalf of all the WASH partners, I would like to appreciate all the county teams represented here, and the partners, especially Fred Holos, for organizing this event, and also Site Savers as partners in this work. And I also like to thank Prof for providing your technical advice in the tag. Mostly, maybe what I can say, much has been said here about WASH, and I think our take home from here is that let's go to our counties and implement what we've had. Let's go and implement these transition plans, and I would love to echo the words of Professor, wash and wait. Wash and, I think that should be our slogan moving forwards. And I know at the county level, and both Kenya and the Ugandan team, we can eliminate trachoma by 2027. Thank you.
Thank you, Kwamboka. One health representative, Rodish. You handed it back to your chief officer, and the chief officer has spoken. That's a good one. Ministry of Water representative? Silence means nobody. Ministry of Education? Nobody. Allow me. Oh, director. CPMO? please come. All right, thank you. Good evening, ladies and gentlemen. Good evening. This is Paul Otu, the County Director in charge of water services, Canada government. Now, in the water sector, I would be saying a little thing. I think we need to commit and remind our partners we need to improve and target increased budgetary allocation in water, health, and in related sectors for us to be able to solve this one problem about Trachoma. Thank you. Thank you, Director. Thank you, Director. Director Education. So thank you very much. I wish to speak on behalf of the education fraternity. We in the education sector, we are more than committed to partner with all the other departments, water, environment, to ensure that all the programs that are planned by government and partners shall reach our community through our schools. We are committed to also want to wish each one of us that we free to seek meet our directors, our CEOs, our national government directors, to be able to allow ourselves to do the education sector of schools, right from ECD all the way to the universities, that we can be able to disseminate health information and any other information that is required to be passed on. So we give our commitment to the same, and we are very grateful that you have invited us to this very important workshop. I say this for the onset that we were talking so much jargon for these people. And at this time, I also have a take home now that there are some things that I need to know. There are some appreciations that you ask me something else, but you people do something else. So we are grateful, and we are going to partner with you and continue in this journey of ensuring that we have a community that has a purpose. Thank you so much. Thank you, Director. Before I invite you, but allow me to invite also we can't forget about our brothers from across the border, Dr. Paul.
So thank you so much, and all the protocols observed. I want to relay our appreciation as the Ministry of Health in Uganda for, first of all, inviting us for this meeting, and also facilitating us. We had to pass through immigration, so facilitating us to come and attend this meeting. Lots of learning for us and our partner site savers. We're going to also go back and see how to do our validations, and I think, just as we said yesterday, for us who are here to learn, and I think the investments that have been made to have us here for this meeting was really a good investment. And next time when you need to come to Uganda, please come. Uganda is peaceful, all is well over there. Come and, join us for similar engagements like this. Cross-border does not stop with trachoma elimination. We still have to do joint surveillance and other activities. One Health is, gaining even more momentum as we move towards, the elimination targets 2027. So thank you so much. Thank you for having us. And we wish you a very safe journey back to your homes too.
Thank you, Daktari. Thank you so much.
Thank you very much. Before I make my remarks, I just want to acknowledge my colleagues here. Everyone from FHF, please stand and wave. They've been doing a lot of work. Yes, they've been doing a lot of work. Quietly, behind the scenes. And of course, Sarah, site savers, we work together a lot. So site savers people, can you wave as well? You know, they do work both in Kenya and in Uganda, and we always meet, so they are friends. Ladies and gentlemen, I just want to thank you very much for honoring this meeting as per invitation sent by Ministry of Health. It is always good to meet new faces as well as old ones. I think I've made more friends, even if I don't remember your name. As long as you're here, for me, you're my new friend. I spent some time in Turkana, in West Pokot. I haven't spent time in Baringo or Kitui or Embu. Because I've met you, I'm going to make it a point. I will come to Baringo. Definitely, thank you. So it is an honor to see all the leaders here present and your commitment to healthcare. On behalf of the Fred Hollows Foundation and on the leadership, this work falls under, of course, the leadership of programs and other aspects, and they send their greetings to you. We would like to pledge our commitment to support as much as we can the work that is ongoing, to ensure that we travel together until the day the World Health Organization hands over the certificate. And then after that, to look after post-elimination surveillance. We are trying to work this into our strategy, and we hope that we'll be able to realize this dream together and to work to ensure that our people do not become needlessly blind. So on behalf of the foundation, and thank you very much. Thank you for hosting us very well in Eldoret. It's called the City of Champions. Yeah, indeed, City of Champions. Thank you so much, and I wish you a blessed day.
Thank you.
Thank you very much. And I stand before you as a very happy person for two reasons. One, as I have told you, I started working in Trachoma program from 1987. And I have always been praying that I'll see the head of Trachoma before I retire. My wife retired from the Ministry of Health. So I'm in my house, I'm called young man, because this young man has not retired. And I still believe it's because that mission will be achieved before I retire. Those of you who know universities have been added a few years. I was to leave next year, but we have been added some 4 years. So we are going to go to 74. And that is why I'm praying that we do that. And I'm very grateful to the Ministry of Health, to the counties, to the WASH partners, to all the implementing NGOs who have attended this workshop. I have never seen such a collaboration and joint action. I want also to thank our neighbors, because as you have said, collaboration will not end up with the trachoma elimination. It will continue with marriage and other things socially. I have in-laws in Uganda. Some are married in Kabaka's family, so I have got in-laws right in. So we will still collaborate. So thank you very much, because this effort, especially with the county governments, I don't know what I can say about the county governments. We have always been saying counties are not active in trachoma. But I think that saying we have been told forget about it. And we pray that you are going to be on the driver's seat and we are going to eliminate trachoma. The other reason why I'm happy, apart from not retiring before trachoma is eliminated, and I believe that is why we have been added those few years, it is because I have been a member of the expert committee for the NTDs. There was a committee which was gazetted, was it 2018? Had given a mandate to implement, what did we call that strategy? Breaking transmission strategy. And the breaking transmission strategy, there were targets we had been given and we were reporting to the PS. Is it PS or Cabinet Secretary? Cabinet Secretary direct by then. And trachoma is one of the diseases we had been told by 2023 we must have eliminated it. And I am one of, because I was the representative of trachoma in the expert committee for NTDs. We had been told trachoma, lymphatic filariasis, onchocerciasis. You have seen people coming to ask about rapids in the counties, rivers flowing and rapids. We have sent them. It's another blinding disease, but this is not its time. There is also sleeping sickness, heart, human African trypanosomiasis. What am I driving at? Trachoma is one of the conditions the national government and partners are looking forward to declaring eliminated. And when Malawi the other day eliminated trachoma, and we know also the other countries like Gambia and Morocco, it's very difficult for some of us to represent you in NTD forum, because last week I think lymphatic filariasis, I saw the LF, they were in coast. They are doing their final surveys, the final task. They are about to eliminate. So trachoma, let's not be laughed at in the NGO world, in the NTD world. Remember that we have committed ourselves, we have committed that we are going to assist our country and also our communities to eliminate this cause of needless blindness. So thank you very much. I wish you the best. And I'm hoping that, Titus, you will not forget to invite me for those celebrations. For the counties, definitely, I have been to all the trachoma endemic counties, although I have stayed for some time without coming to the counties because I am at the technical level and I'm also teaching up to this age. I would like to come and celebrate with you. So thank you very much. Have a blessed journey, and I hope to see all of you again. Thank you.
Thank you so much, Prof, for taking your time to be part of this meeting. We really appreciate your input in supporting us towards trachoma elimination. And on that note, allow me to invite the mother ministry, the Ministry of Health, through the National Public Health Institute, like us, as you make your closing remarks. You request you to officially close this meeting. Thank you.
All right. Okay. It's a big task you've given me, but I don't want to stay between time and people. As Prof has said also myself, my heart is full because I'm happy to see the mix that is here. People from the water sector, people from the political wing, chairs of health committees, because that is what is needed. A whole government approach to eliminate trachoma. Transition is something that is real, something that we have to embrace. Not that it's not happening at the county. I'm sure in Baringo there's training on trachoma that is going on. There is reporting of trachoma cases. You go to Chemolingot, you'll find Surgeons who have not even been trained, they are just doing on-job training. They are carrying out trachoma surgeries and helping our people. So the county is doing a lot, and that is something I have to really commend you on that, and you continue doing that. And for the 5 counties here, you are the pioneers, I might say, in trachoma elimination. Others have eliminated trachoma in all those aspects of safe. There are no surgeries that they are carrying out, no antibiotic treatment, and they are doing F&Es. They are ready to celebrate. Others, a little bit has left. In fact, on these 5 counties, it's only Turkana that is remaining with our sub-county that requires 2 rounds of MDAs, and it's done. And it's at the border, so we have to give it all the support that we need. So mine is just to say I'm really, really happy, and to thank you wholesomely, the county governments of the 5 counties, to thank the implementing partners who have made all this possible, site savers, WASH partners, partners from the education and water sector, One Health partners, and last but not least, FHF for their overwhelming support in terms of financing and getting us together to this a lovely workshop. Our brothers in Uganda, thank you so much for coming over. We don't take that for granted. And as you go back, the courage, this is the land of champions. Don't be in such a hurry of going back. Remain behind and use the Ugandan shillings. Enjoy the whole weekend. There are sites here in Eldoret. Can even move down there to Tiati. It's not so far. Nakopir will host you there. Yeah. So thank you so much, and safe journeys as you go back to your respective counties, and I wish you a great weekend that is coming up. So thank you, and with the powers given to me by FHF Ben, I close this meeting.